Let me thank Senator Wyden for his leadership on fixing this physician reimbursement structure under Medicare. And to Senator Blunt, I want to thank him and Senator Stabenow for their leadership on the mental health demonstration program that's in this. Whatever bill we pass will be in it because it's absolutely essential that we address the growing problems in our community health network. So I thank both of them for their bipartisan leadership. Mr. President, the current way that we reimburse physicians under Medicare is broken. The SGR system has been broken since it was passed in 1997 as part of the Balanced Budget Act. We have had 16 temporary patches to the SGR system, and it's created uncertainty, not just among the medical community as to what the reimbursement rate will be for Medicare patients, but it's caused uncertainty among Medicare patients as to whether they know that their doctor will be there to treat them for their illnesses. If we don't fix the problem, we let it go off the cliff, we would see a 24% cut in reimbursements to physicians under Medicare. That's not sustainable. As we know, it would affect access to our seniors and disabled to their doctors. We have to fix this problem, and it expires today, March 31st. So we've got to take action. But we have two choices. One is that we could take advantage of the opportunity not just to make sure we don't go off the cliff, but to actually fix the problem. And that's what Senator Wyden has been able to put together with Senator Hatch and with our colleagues in the House, a replacement that will actually work, that will actually reward physicians for taking good care of their patients, by managing their care, by bringing down the costs of health care, by managing our delivery system, taking high-cost patients, treating them so that their illnesses are treated, but also done in a more cost-effective way. That's what the replacement would do if we could pass a permanent fix to the SGR physician reimbursement structure in Medicare. We have a bipartisan proposal. That bipartisan proposal will reward proper delivery of care. It also takes care of the therapy caps and other of the health care extenders. I mentioned that because Senator Collins and I have been working a long time to try to get a permanent replacement to the arbitrary cap on therapy services. That was also put in the 1997 BBA Act, Balanced Budget Act. And what that did, that 1990s, it put an arbitrary cap on therapy services. So the more severe you're injured, the more severe your illness, the less services you'll be able to get that you need in order to take care of your illness or injury. And that makes absolutely no sense at all, and we fixed that. So why are we debating this? There's strong bipartisan support because there's two proposals that are out there. One that Senator Wyden has brought forward that fixes the problem, that substitutes a rational system, and it's paid for. I could argue it's been paid for many times over. It's been paid for because we have already passed patches that have been paid for $153 billion. That's more than what this patch costs, what this permanent fix costs. And who's paid that $153 billion? It's been clinical labs, it's been skilled nursing facilities, it's been community health. All those have paid for a problem they didn't create within the Medicare system. This has been paid for already. It's been paid for already it's current policy. No one expects us to go off the cliff. But Senator Wyden, in an effort to say, okay, we're going to try to deal with this in an upfront way, CBO is now scoring this proposal to be a little over $100 billion, $118 billion. That's a bargain considering just a couple of years ago it was $300 billion over a 10-year period. Mr. President, I remember in 2005, I filed a fix of this bill with then Congressman Clay Shaw, bipartisan bill, scored at $50 billion. This has been paid for many times over. But Senator Wyden, can I ask consent to speak for 2 additional minutes?
Is there objection? Without objection.
Thank you. But Senator Wyden, in an effort to try to accommodate everyone here, they said, okay, we'll take this cost savings that's already in the House bill. I could argue that has really nothing to do with the physician problem, but it's ones I think we can agree on. So we have real cost savings of over $20 billion that Senator Wyden has put in his bill. He said, okay, then we have these scored savings under the overseas contingency operations. Let's use that if people feel that we have to have an offset, even though we've already paid for it over and over again. So we have two options. Another temporary fix continuing uncertainty, continuing this problem down the road, asking those who didn't cause it to pay for it, even though it's already been paid for before, or we could really take care of it and tell our medical community, let's work on other issues to improve our healthcare system, rather than coming down here every year asking for a temporary extension of the Medicare physician reimbursement structure and not allowing the SGR system to take effect. That's the two options we have. So I just came down here to thank Senator Wyden for putting forward a proposal that would fix it, that would really do it, so we wouldn't have to come back again next year. The Congress can really get something done, and it's bipartisan, it's bicameral. The fix has already been signed off by the House and the Senate. And Senator Wyden's come up with a plan that we can also be fiscally responsible. I would urge my colleagues to go down the path of fixing the physician reimbursement structure so we can take that uncertainty out of the Medicare law, do what's right for our Medicare beneficiaries so they have the certainty of their care under Medicare, and do it in a fiscally responsible way. Mr. President, I yield the floor.